Breast lift and breast enlargement is a simple and safe procedure. Plastic surgeons in Turkey constantly treat female patients from around the world. Here, you can combine the surgery with a nice vacation. The perfect climate and ocean breeze enhance recovery, and healthcare system of Turkey offers plastic surgery at lower costs and more preferable than in many other countries. In this video, we're going to show you how breast lifts and augmentations are done. Also, we'll show you a Turkish clinic of plastic surgery and introduce a doctor treating patients from other countries in Antalya, Turkey. So do follow our channel for information on medicine in Turkey. In youth, colors shine bright and life is light. With time, everything shifts, but the beauty of one's forms can be regained. Like blow air in lost shapes, breast lifts and breast enhancements are easy and safe procedures. Turkish plastic surgeons constantly treat patients from all over the world. Here, surgery pairs well with relaxation. The ideal climate and sea air promote healing. And peculiarities of Turkey's medical system make plastic surgery cheaper and more accessible than in some other countries. The main thing is to choose a good doctor at a good clinic. Healthy Turkey directs patients only to such specialists. Currently, silicone implants are utilized for breast enlargement. However, if the breasts are very large or sagging, we can perform a lift using the patient's own breast tissue. Dr. Uğurcan Şener, a plastic surgeon in Antalya. He graduated from Ordu Scientific School and the Medical Faculty of Gazi University, specialized at a teaching and research hospital in Ankara. He worked in rural areas during his civil service, accumulating good experience in aesthetic and reconstructive surgery, a member of professional associations, married, and enjoys sports and literature. Currently, we use new generation silicone implants in plastic surgery, which is guaranteed to prevent issues like rupture, cracking, and leaking. These implants ensure excellent outcomes. As a result, we often choose silicone for breast surgeries. However, if a patient shows sagging during certain procedures and has a large breast size, then we can perform a special breast lift operation, giving it an autologous shape using the patient's own breast tissue. This affects about 25% of our patients. How do you carry out a breast lift? What exactly the surgeon does? For the lift operation, we first draw on the patient's breast together on the morning of the surgery. We assess how much the breast tissue will rise according to this drawing and whether we will achieve a certain reduction or maintain the previous volume. We decide this with the patient. We ensure that the breast tissue will be lifted during the operation, first by elevating it and then reducing its size. It's essential to find out if the patient wants to increase her breast size with the lift, because if she wants to make it bigger, we can add a silicone implant if she does. On the other hand, if she wants to keep the same volume, then we can give the breasts the desired shape using her own tissues. After the surgery, small stitches are usually placed around the nipple and below it. They can be different types on the initial size of the patient's tissue. If the breast tissue is very large and needs to be reduced, the scar may extend into the inframammary fold in the shape of an inverted letter T. Could you explain how you increase breast size and what materials you use? We perform breast augmentation as follows. We draw a small design on the breast with the patient in the morning. Next, we make a cut roughly 4.5 to 5 centimeters below the breast fold. Once we enter this incision, we create a pocket under the breast tissue or under the muscle, or using a combination of both. This depends on the patient's breast tissue. We make the pocket and put the silicone implant in place. The most preferred implants used today are the so-called round silicone shapes. They are characterized by offering equal volume from every angle. We can modify the distance from the base to be very high, high, or low based on the patient's preferences and needs. We use this kind of silicone most often. However, there is another kind of implant which we refer to as a teardrop prosthesis. Typically, the lower part is fuller and the upper part is hollow. We can use it in cases where there is a certain volume of tissue on the upper side of the breast and the patient wants to fill the lower part more. This provides a more attractive, natural breast shape. Then we can select this teardrop implant. The cut placement is the same in both situations. The pockets are also the same in both cases. Based on the patient's preferences prior to surgery, we jointly decide if teardrop or round implants can be used. What contraindications exist for breast lift or breast enlargement surgery? We always want to see breast images before the surgery and choose the type of imaging based on the patient's age. We can use ultrasound or mammography for imaging. Because if there are any formations in the breast tissue, the tissue may need to be removed. Or a prosthesis may be placed, and its shape or position can change depending on the form we give the breast. We try to avoid operating on patients with suspicious findings in their images and send them for a general surgery consultation. Or if the patient has any autoimmune disease, or a connective tissue scar, or maybe a serious blood clotting disorder, we, as a rule, do not want to perform our surgery, as the breast is a tissue with many blood vessels and we need to place stitches. Every surgery and its preparation demand the best medical equipment available. This should not be neglected. Even if the surgery turns out to be simple and common, it is still an intervention in the body. The clinic's equipment and the qualifications of the staff determine both the procedure's quality and the risk of complications. Thus, selecting a surgeon and a hospital should be done with care. What can happen if someone disregards this? We covered it in a video linked here. Watch it and please be cautious. To prevent issues, I strongly suggest consulting with real experts who know the Turkish healthcare system well.
After a person submits a request for treatment in Turkey, we, the coordinating doctors of Healthy Turkey, select the best clinic and doctor for them based on their diagnosis, wishes, and needs. As practicing Turkish doctors, we know exactly how to do this as correctly, quickly, and effectively as possible. We constantly accompany the patient throughout the whole trip, and we always stay in touch for any questions that may arise even after the patient returns home.
How long is the post-operative period, and what guidelines and restrictions apply to patients during this time? In fact, the answer to this question will vary depending on the specific surgery performed. Post-breast reduction surgery, the recovery period tends to be longer. Because of the location and the number of stitches, we recommend that patients wear a corset for a longer duration, around 2 months. After a breast lift or a simple breast augmentation, there is a very small scar left. Thus, we generally ask patients to wear a corset for about a month. The stitches we use in all breast surgical operations don't need any special removal post-surgery. After a specific time post-surgery, after bandages are removed, the patient can have a shower and engage in daily activities as always. Initially, one should pay attention to how they move their arms. In the early days, you should not spread your arms wide. Hands can only be open to a certain extent. A patient needs to refrain from heavy activities and wear the recommended bra in post-surgery period. How long does the effect of a successful breast surgery last? Typically, women who undergo breast reduction have already completed childbirth and breastfeeding. This is why, after this operation, the results for patients can last a lifetime with the right size and lift. Yet, lift and prosthetic surgeries are often carried out on younger patients. If they see a considerable increase or decrease in weight over the next years, or if they have multiple children and then breastfeed, then an extra lift may occasionally be required for them. There may be a need for minor adjustments. Turkey is advantageous compared to other countries with its thorough approach to patient care. In other countries, it's common to pay separately for each service. The company Healthy Turkey manages the visits of medical tourists to Turkey under an all-inclusive system, working only with verified specialists in both healthcare and hospitality areas, coordinating all services for each patient. Healthy Turkey takes care of it all, from consultations and arrangements with the clinic and doctor to transfers, lodging, immigration details, and translating medical documents. You can see the company's website address right on your screen. This site allows you not only to consult, but also to find information about other quality medical services in Turkey. We're regularly telling you about treating different diseases and the care of medical tourists in this country. So, do subscribe to our channel to catch new videos, and we appreciate your likes.